All right. I hope everybody's in. Good afternoon, everyone, and thank you all for coming along to today's session, which is briefing the voluntary sector and talking about the vaccination programme running in Richmond upon Thames. But thank you very much for all coming along. And before we get started, I just want to say a big thank you to you all for the amazing work that's been going on over the last, coming up to 12 months now. Every time I start one of these sessions, I always like to start by saying thank you. It's been awe-inspiring seeing the amount of activity and work and activities that have been going on to keep everybody who needs sort of the help and support over the last 12 months has been absolutely amazing, and is testament to the voluntary sector as a whole in Richmond upon Thames, I think, for what has been achieved in very difficult and challenging circumstances over the last 12 months. So thank you very much. I hope you'll find today's session helpful, and will give you and your organisations a little bit more information about what's going on at the moment. And to help start that process off, I'm going to hand over to Councillor Allen now, who's going to give us a little bit more, and then I think Catherine Williamson from Richmond CVS will be coming on. So thank you, everyone.
Yes, thank you all very much for coming today, and I'd like to echo Councillor Wilson's thanks for all your involvement. As I hope you're all aware, the Council has been working very hard to minimise and mitigate the impact of COVID in the borough. Members, particularly Councillor Roberts and I, have been are very much involved in monitoring the latest figures that sometimes before they go into the public domain, and working closely with our officers to make sure that we're as on top of things as we can be. We also have a local engagement board that's part of the sort of COVID-19 system and so on, to making sure we engage with our communities, and you're a very important part of that. So I'm very pleased you're able to come today to share some of the insights into the vaccination rollout and the important part I think you're going to be playing in that as we try to get to some of the communities who've yet to come forward. Over to you, Catherine.
Thank you very much, Councillor Allen and Councillor Wilson. And hello, everyone. It's really nice to see you all. My name is Catherine Williamson. I'm the Director of Richmond CVS. I think a lot of you will know who Richmond CVS are, but just to be sure everyone knows, we're the support organisation for the voluntary sector in Richmond. So we help organisations make sure that they can run as successfully as possible, helping them with funding advice, governance advice, running lots of training for them, offering one-to-one advice sessions, for example, on how to obtain funding. And we also run a volunteering service as well, so helping organisations recruit volunteers. And as I think a lot of you know, we've had a lot of interest from residents in the last year, particularly to help with the support effort around COVID-19. Over 3,000 volunteers registered with us, and I know a lot of you have used them in various ways, which has been absolutely brilliant. And of course, I echo what the councillors have said already about how fantastic the local voluntary sector is. I'm also really pleased that we've got this opportunity this evening for you to hear more about what's happening around the vaccine programme, and have a chance to ask some questions as well. I know a lot of you, when you registered, you were asked if there are any particular issues you wanted covered, and some of you did put some things down. Hopefully a lot of those will be covered in the presentation, but if not, you will have a chance to ask a question as when we get to the Q&A bit. So I've also just got to do the housekeeping bits for this evening. So this is just to remind everyone that the event is being recorded this evening, and it will be published afterwards on the council website. I think it'll just be focusing mainly on the speaker, but if you do want to turn off your camera, that's absolutely fine. You will be hearing from a range of people in a moment. We will have Shannon Katiyo who's the Director of Public Health at Richmond Council. And we'll also be hearing from Tonia Michaelides, who is the Richmond Executive Locality Director for the CCG, and she's the lead for the vaccine rollout. And also we will be hearing from Dr. Patrick Gibson, who is the GP lead for Richmond for South West London CCG. So again, just carrying on with the housekeeping, we intend to have the Q&A session after you've heard presentations from the other panellists. If you wish to ask a question, rather than using the hand tool, what we're going to ask people to do is to write the word question in the chat. And then when we get to the Q&A bit, we will come to you. I will ask you to turn on your camera, and you will be unmuted by the comms team at the council, and you'll have a chance to ask your question. Please do say which organisation you're from. I know a lot of people on the call this evening are here with an organisation they're connected with, so please do say which one it is, because it's always nice to hear where people are coming from. And then you'll get a chance to say your question. So yes, write question in the chat if you want to ask a question. We're trying to sort of encourage people not to use the chat for sort of general comments. And as always with these events, Zoom etiquette, which I think you've been sent the Zoom etiquette guidance that the council has been distributed to all participants. So obviously we do ask that everyone adheres to that. And if anyone doesn't adhere to that, then obviously steps will be taken, because we're just trying to make sure we focus on the issues of the vaccine tonight, helping the voluntary sector to support the community to get vaccinated, and to ensure that we also get a chance for the voluntary sector to say if there are some particular issues that they need addressing, because I know that our panel are keen as well to support the voluntary sector to do what they can over the coming months. So if you do ask a question, please keep it brief if you can, so we can get through as many issues as possible. And then after the event, you will be emailed with any relevant information that has been discussed. Right, I think I have covered everything that I need to at the moment. And so I'm now going to hand over to Shannon. Shannon, you might be on mute.
Thank you. Good evening, everyone. I'm Shannon, Katiyo. I'm the Director of Public Health for Richmond and for Wandsworth as well. I've got a slide set which I thought would be useful to share with you, just in terms of setting the context in terms of why the vaccines are important. But also, I'm really pleased that the people who are on this meeting this evening did ask for us to talk a little bit about the testing and the testing strategy. I think it's really important for us to understand that whilst the vaccine will eventually have an impact in terms of the rates of transmission, actually there are other parts of our strategy to tackling COVID that will continue to remain important for quite a while to come. So I was really pleased to talk about testing as well this evening. So just to set the context, I'll give you a little bit of an update on the sort of remarkable journey that we've been on and unfortunately are still on with regard to COVID in the borough. And then I'll come on to talk about the lateral flow testing that you've requested me to talk about this evening. And then finally, I'll just talk a little bit around the Community Champions program that the council has started, which I'm sure you'll be excited to hear about. So starting with the number of cases, I think the main point to highlight this evening is that, as you can see, that is a timeline that spans from last April, last spring, until where we are now, so just about a week or so ago. We've been on a remarkable journey. You can see 3 distinct humps that we've had in terms of waves of the pandemic, and it's also quite clear to see quite visibly the increasing numbers of cases that we've seen in Richmond throughout the course of the last year. And obviously, as testing has become more widely available, well, the more we've tested, the more cases we've been able to detect, and latterly the asymptomatic testing becoming a significant part of our plan to tackle COVID. So the key thing is to just mention that you can see that since the beginning of January this year, we reached an all-time peak in Richmond that we'd never reached at any time in the pandemic. And we're in a steady decline down. But actually, we can't be complacent, because even though we are seeing a decline in the number of new cases daily, we've still got a long way to go to get anywhere near the levels that we saw last summer. In my next slide, one of the concerns which is particularly relevant to the conversation around vaccines is the fact that whilst we've seen particularly high rates of cases in people under the age of 60, we also continue to see reasonably high rates in people over the age of 60, obviously also declining. But we do know that people who are over the age of 60 or 65 are the ones who are most likely to end up with more severe illness, more likely to get into hospital, and also potentially more likely to die as a result of COVID. And ideally, what we would like to see is the rate of new cases in the older age groups falling rapidly. And I think, you know, the vaccine will really help us to have an impact in terms of protecting people from serious illness and preventing the need for them to be hospitalized. Now, in my next slide, I just outline here that, as I was saying earlier, we can't be complacent. We still have high numbers of people who are admitted into hospital. And in that chart, you can see the number of people admitted into hospital daily in Kingston Hospital, and also Chelsea and Westminster NHS Trust, which includes West Middlesex. And you can see, compared to last spring, when we, you know, thought the pandemic was bad, actually the hospitals are really in the thick of it now, and they're still really busy. We have started to see a glimmer of hope in terms of tapering off of the number of people in hospital, but you know, nowhere near where we would like it to be. So that's why it's absolutely essential, as we're talking about vaccines, for all the people who've been offered vaccines to take up on that vaccine to help us reduce the level of activity in the hospital, and also potentially to save lives. Consistent with the picture that we see in other phases of the pandemic, the numbers of new cases have to start going down before we can see any impact on the hospital admissions. And the last thing that we would hope to see following that downward trend is the number of deaths. Now, the data I have presented here is 2 weeks in arrears, because obviously it takes time for the deaths data to make its way over to us. But I just wanted to highlight that we are still seeing on a week-by-week basis the number of people dying in Richmond, COVID-related, still going up. And so if you can just make out on this chart, I think a couple of weeks ago, or up to 3 weeks ago, we had, unfortunately, about 20 people die in a single week in Richmond as a result of COVID. And that number actually went up in the subsequent week to around 25. So we do continue to see that tail lag of people dying. And again, this just really emphasizes that, you know, with the vaccine coming in and people of a certain age being more likely to be admitted, we hope that this will start to have an impact. But obviously for everybody else, we need to continue to follow the public health messages. People need to continue getting tested. So moving on to testing, which you asked me to speak about, I'm really pleased about the effort that we've made across the council to rapidly establish lateral flow testing. This was something that came to us as soon as the technology was available, and I'm pleased to say that the London Borough of Richmond was one of the early adopters and implementers of the lateral flow testing program. Now, lateral flow test kits, as some of you might know, are a technology that enables people to get really rapid results, so within 30 minutes of testing. And currently the process works this way, that you can book for a lateral flow test kit on the council website. We now have 3 centres available: Clarendon Hall, Sheen Lane Centre and Linden Hall Community Centre. And you book your allocated slot, you turn up, you get your test, and then once you've left the test centre, then hopefully you should be able to, within the course of the day, get a test result. And in fact, the test results come through within about 30 minutes to an hour, and then they're fed into the system and you'll be able to receive a test result. Now, it's important to stress that the community testing program using lateral flow test kits is for people with no symptoms. And this is an expansion because we already have a successful testing program for people with symptoms, but this is trying to preempt the fact that we know there is asymptomatic spread of COVID, which means that people who are not showing any symptoms are able to spread the virus. So going forward, the community testing program using this particular technology will continue to be an essential component in our sort of arsenal of weapons, if you like, in the fight against COVID. We've rapidly increased the capacity for our lateral flow test centers. They are now open 7 days a week, so people can access those, and they're complementary to a whole range of new options that are coming through as national testing programs from the Department of Health and Social Care. And in the last couple of weeks, I'm pleased to say that there is now a routine testing program for adult day centers, which is something that we've been fighting and asking for a really long time. And the government has also announced that any large employers employing 50 or more people across the country are able to apply to the government to get a supply of test kits. So at the moment, we're really encouraging any people who are unable to stay at home because of any of their work responsibilities or caring responsibilities to come into our test centers to access testing, so they can make sure that they are not inadvertently spreading coronavirus because they're not showing any symptoms. I think I've highlighted the groups that we're targeting at the moment for testing. We also have lateral flow testing available to other settings across the borough, including the universities and any other settings where, for example, secondary schools, where we need to ensure that staff and also the users of those services are safe. We have done quite a lot of work to ensure that people have access to testing who need it the most, because sometimes we know that there can be some inequalities, and potentially the people who are most concerned but maybe less in need are those accessing testing. So we're working very closely with our testing providers and testing centres to ensure that testing reaches all parts of the borough and all people who are in need of testing. So just to give you a flavour of where we are with testing, since the 1st of February, so this is just over a week, over 1,391 tests have been undertaken, lateral flow tests in Richmond. And obviously we're doing this to support the voluntary sector and also workplaces. I've talked a little bit about the hours and the expansion. We are also looking at a longer term strategy for embedding testing, because as you all know, and we'll talk about this with the vaccines, that the rollout of vaccines is hopefully intended to cover all the adult population, but that's going to take some time. So testing will remain an important component, and we are working with our pharmacies, for example, to find a long-term solution to embedding testing in communities closer to where people live or work, so that there are as many opportunities as possible for people to test. And also for people who are working or volunteering in Richmond but live elsewhere, we've reached a mutual agreement with other public health teams across southwest London, so that actually you can test anywhere across the southwest London boroughs and be able to access a lateral flow test kit. So it doesn't have to be in Richmond. Actually, if you're closer to a neighbouring borough, you're able to access that through their council website as well. And just finally, I wanted to talk about the community champions. A lot of you will know that there's been a lot of disinformation around COVID, and it's really been a struggle, particularly in some sectors of the community, to try and encourage people to uptake these vaccines, which we know are very safe, they're very effective, and they will potentially prevent people from becoming seriously ill or needing to be admitted into hospital. So the council has recently launched a COVID-19 Community Champions program. And the purpose of this program is to provide an opportunity for any residents in the borough of Richmond to come forward and help the council to build a diverse network of people who can share information, trusted, reputable information with any of the communities that you mix with. And we think that, you know, this will give us a really good opportunity to tackle the disinformation and actually give people the correct information that will enable them to make the right choices with regards to vaccination, COVID, and other things. So anyone who lives or works in the borough of Richmond upon Thames can come forward on the council website to register for this program. You will get a support package around this, so you don't really need to worry in terms of, you know, where will I get the information, what do I need to do? All the steps will be laid out for you. So you have the link there, and we'll make sure that we circulate it, and you can go and search on the council website as well, and you'll be able to find that information. So I think this marks the end of my presentation, and I think there will be an opportunity later on to take some questions, and I'll be happy to answer those. Thank you.
Thank you very much, Shannon. That was a very comprehensive presentation. Yes, you will have a chance to ask Shannon any questions after we've heard from our other presenter. Right, thank you very much for that. Now, due to the live nature of this evening, things can change, and we have had a change to our lineup of speakers. Unfortunately, Tonia can't be with us this evening now, as she is unwell, but I understand that we still have Dr. Patrick Gibson. I can see him, so I know he's here. I think, Dr. Gibson, you're kindly going to sort of cover Tonia's area as well, is that correct?
Yeah, thanks, Catherine. And apologies to Tonia, it was quite short notice. She's become unwell this afternoon.
Dr. Gibson, we can't hear you very well. You've suddenly gone quite quiet. Are you able to enhance your volume a little or speak a bit closer to the mic?
Or I would...
No, can't hear you at all. Gone completely now. Sorry about this. It's like live TV, isn't it, really? So do remember, you will have a chance to ask questions, so do be thinking of those questions that you would like to ask. It's a good job it's a friendly audience tonight. So let's...
Catherine?
Yes?
Could I make a suggestion? I might be able to, if we struggle, provide an abridged version of, if I dare do so, an abridged version of where we are with the vaccines if we do continue to face technical difficulties. Obviously not to the same extent as Tonia or Patrick Gibson would have done.
I appreciate that offer, Shannon, and we'll see how we go. I do feel a bit guilty because we could at least hear Dr. Gibson slightly. It was just very faint, so I don't know whether you're coming back with any higher volume. Do you want to try again, Dr. Gibson?
Yeah, I'm trying to, Catherine. How is that?
I can hear you, but I don't know whether people, it's not great, is it? People, I think, are going to struggle a bit. Should we play the recording from the Healthwatch event at this point? Because I think it was, we could see Tonia's presentation then. What do we want to do? Do you think you're going to struggle? Oh, hello, Ellie.
Hello, this is Ellie. I do have the slides that Tonia and Patrick were going to use. So perhaps if Patrick is still having problems with the sound, I can start, and Shannon, you could maybe start talking through them. And if Patrick, in the meantime, manages to get his audio fixed, then can come in. Does that sound like a plan? Is that okay with you?
That sounds like a bit of a plan. I know someone has put in the chat, Becca has said that she can hear it, but I'm just aware it does sound quite quiet. I don't know, Ellie, what you think about the volume level from Dr. Gibson at the moment.
Dr. Gibson, would you like to try again, just so we can see how loud you are, and if people in the room would like to nod their heads if they can hear him.
Okay, I'm just going to try a couple of. Is that any good?
Can everyone hear him? Yeah, people are nodding. People are nodding. Yeah, we've got some thumbs up. So
there are a couple of some people who are shaking their heads as well. It's a mixed response, unfortunately. I wonder if we are going to have to go with Shannon's offer, unfortunately. Is there anything else you can do, Dr. Gibson? Yes, I mean, I was hearing a few people saying it's too quiet, and I know how frustrating it is if you can't hear things properly. It's hard to concentrate.
I'll try and go in and come out again. I think
that's a good idea. That's a good idea. Thank you for that, Dr. Gibson.
So Shannon, shall I start sharing the slides for you to?
Yes.
Okay. Thank you, Shannon.
Thank you, Shannon. That's very kind of you. Appreciate you stepping in.
I hope I won't regret my my bravery, but I'll give it a shot. Right, so there's been an absolutely massive immunisation programme across southwest London to date, obviously led by our colleagues in the NHS. And I think it's been described as an unprecedented, or the biggest immunisation programme that we've ever had in the UK to date. And if Tonia or Patrick were here, they would cover where we are with delivering the vaccine, how the NHS is contacting people. I can't say we now because it's the NHS contacting people, which groups are being prioritised based on the recommendations from the Joint Committee on Vaccinations and Immunisations, and a bit of an update on progress with that. And I know there's a lot of work that is across the Council and the NHS in terms of communications and engagement with particular groups to ensure that we get as much coverage amongst those priority groups as possible. Do you want to move on to the next slide? Thank you, Ellie. So I think across southwest London, we started off with hospital hubs that were offering vaccinations, but actually lately we've now got a combination of GP-led primary care sites, and I think there are over 35 of those sites now available across southwest London. And in addition to those, we've got large vaccination sites, and the site in Twickenham went live, is it last week now, at the Harlequins at the Quinn Stadium. So that's really quite a large site that can vaccinate people, large numbers of people. In addition to that, there is a roving model where vaccination teams have been going into care homes, because we know that care homes were in the top 4 priority groups, as well as to vaccinate some of the staff there. And also for people who are not able to leave their homes. I don't want to use the term housebound, that's not correct. People who are not able to leave their homes for whatever reason are also able to get the vaccine provided to them within their homes. Next slide. So in terms of the groups that are being prioritized and the people that we're contacting, so in the United Kingdom, we've got the Joint Committee on Vaccinations and Immunisations, and this is the group that looks at the vaccines to understand how they work, and then determines which groups in the population can be prioritized. Now, if you think back to the slides that I showed, that were showing the people, the age groups that are most likely to end up being in hospital and to end up, unfortunately, dying even from COVID, it's the older age groups. And so the overriding categorization of people into different priority groups based on the JCVI recommendations is around age. But also throughout the pandemic, we know that residents of care homes have been disproportionately affected. So in order to prioritize people for vaccination, the JCVI has recommended to start off with those people who are in care homes, and obviously the staff who are working with them, to ensure that the people in the care homes are protected. And then the rest of the age groups, really working all the way down, are based on a prioritization based on age, because we know that this is the biggest risk factor in terms of potentially becoming severely unwell or dying. So there's an...
Shannon, sorry to interrupt you, but I was just going to say Patrick Gibson has just come back in, and he's
excellent.
His sound again. I don't want to disrupt your flow, but I thought you would always...
That's fine. Let's give it a try.
Dr. Gibson, can we hear you? That doesn't sound very hopeful.
That's okay. I've been unmuted now. Good.
Oh, Well, that's a bit better, isn't it? Is there a general view that that's good? Let me just put the full screen on there, nodding.
Lovely. Thank you very much.
Thank you very much, Shannon, but we'll go over to Dr. Gibson if you're happy to take over.
Yeah, thank you very much. So, Shannon, I can see you're down to the cohorts there. So, the cohort system is really important because it's driven, this process is driven nationally, and the ask of all of the sites has been to stick to those top 4 cohorts and make sure that they are optimised by the 15th of February. We were fortunate in Richmond in that we got going early and have got ourselves into a very, very good position with this. Annoyingly, there's a dearth of of data that we can present publicly at the moment, and because it hasn't been corroborated centrally, we have local intelligence about where we are with each of the cohorts, but we're not in a position to share that publicly yet. But Richmond is the highest performing borough for vaccination in the information that's being presented to us. We probably by now, the last data we had at the end of last week, we were nearly through cohort 4, and I anticipate that we actually are probably finished cohort 4 now. The system that we've had with the primary care network vaccination sites is that the primary care networks are a collection of practices that function together, and one of the clinical directors, one of the doctors, organises it for that network, and they use the data sets they've got on their computers to enable to identify the care home residents, the housebound, the over 80s, the clinically extremely vulnerable, and they prepare lists of patients in those cohorts to vaccinate, and they report back to me about how many patients are left within the cohort. So all the way through the process, we know approximately where people are through this. And the objective has been to try to make sure that everybody's moving at a similar sort of pace, although there's inevitably variation week by week, simply because delivery is not controlled by the primary care network sites, so they can't in advance order vaccine. They're told what vaccine they've got, and they then try to work through those cohorts. So we're coming to the end of cohort 4 now. We're already into cohort 5 because by definition, you're not going to get exactly the same amount of vaccine as there are for exactly the number of patients in a cohort. So there comes a point where you start to leak into cohort 5. But the message going out to the PCNs is to stay as tightly to those cohorts as they possibly can be. In addition to the PCN local vaccination sites, there have also been vaccination sites in the hospitals who are predominantly geared towards delivering that service for healthcare and social staff. And there are also some excellent roving teams that have gone out, which are for us from Hounslow and Richmond Community Health. And they've worked very closely with the primary care network local vaccination sites so that all of the housebound patients have been covered. And as I say, by the end of last week, we knew with the housebounds that something like 90% of the housebound population were covered, which was really, really important because that population are potentially at quite high risk because they're often having carers coming into their homes who may have been to other homes. So there may well have been older patients who are more independent, whose one visit may have been to go to get their vaccination. So the housebound were a really high priority for us. And the other group the other site that have been vaccinated locally are the mass vaccination sites. And that started at the Stoop, which is our, at Harlequins, which is our local mass vaccination site. And they've been running now for about a week. I don't want to talk too much because a number of you have already sat in on the Healthwatch meeting, and I would like to make sure we've got lots of time for questions. But I'll just talk about how the system works. The pressure of work in delivering this programme is tough. It's on top of the primary care network sites, it's on top of normal business as usual in the practices. So we want the public to adhere as closely as possible to the national approach to this. So Basically, patients will get a contact when it's your turn. And because of the point I was making before about delivery to different areas being not necessarily consistent, you might well find that a neighbour close by, attached to another primary care network, may be invited before you. Do not worry, stay with the programme until there's an announcement that your cohort should have been covered. So last week, or this week I think it was, this week, we have, there's been a national announcement that if you are in those top 4 cohorts, so basically anybody over 70, and if you haven't had an invitation for a vaccine, then to get onto your practice. So that is the time to stop contacting the practice. But the request really is the patient, for the public to be as patient as possible until that point. We are using a series of mechanisms to contact people, some phones, some text messages, some letters. We are contacting people on 3 occasions. And we are trying to make the last contact from a senior clinician who knows the patient, because we know from experience that often that conversation may persuade somebody to have a vaccine when hitherto they've been reluctant. So we're trying to use that three contacts approach as best practice. At the end of that, if somebody still declines vaccination, that's fine, they're still entitled to it. So at any point afterwards, if a patient wants to come back and get vaccination, there will be supplies there. The next point on that, there's a little bit of potential for confusion because you've now got the mass vaccination site started up at the Stoop, and you've also got the primary care network, local vaccination sites, both of whom are contacting patients independently. There is a tension between trying to get the whole population vaccinated as quickly as possible against the potential for confusion from different sources. The public are free to use whichever suits them, whether that be a matter of speed of vaccination or it being more local. So some people would prefer to go to their local practice type site, and some will go to the large vaccination sites. Both are fine, and the patients can exercise their own choice in that. The last point, GP and community mobile, so that vaccination housebound. So that's the end of that slide. Is there another slide after that? So all care home staff, so not only have we performed highest on the care home staff, we've also delivered vaccine to 60% at the last count, of the care home staff. Now, you'll know from the public, from the media coverage of this, that sometimes vaccinating that care home staff population, because of the demography of that group, has been more challenging. So we put a lot of work into trying to support those members of staff by educating them about the vaccine, trying to dispel myths, and we've been very successful in that, and we continue to work hard on that because it is a key objective to get as many as possible of those care home staff vaccinated. Tonia's slide there about the 200,000 jabs, that is the highest in London. It's higher than that now. Just to give a perspective of balance, about 150,000 of those have been done in the primary care network sites, and the rest elsewhere. And we are, the last point there, starting to see data published on the NHS website, which continues to give us confidence. I haven't seen today's, but I know that I've seen our local data from my primary care network sites, and I know we're in a very strong position. Next slide, please. Yeah, the other point really is just the massive thanks to the community. So the support that the primary care network sites and the mass vaccination sites have had with volunteers has been extraordinary in all ways: provision of tents, marshalling, supporting people with transport. So a massive thank you out to the community of Richmond, as we always have done. We've excelled really in that regard. So leaving time for questions, I'll stop there.
Thank you very much, Dr. Gibson, and thank you for battling with the technology. I know you're extremely busy at the moment. You must be exhausted, so I appreciate what last thing you want is to have technical difficulties, but thank you for persevering and being able to solve them. And thank you to Shannon as well for nobly stepping into the breach. So a good team effort there, and that was very helpful. Thank you. Right, we are now at the point of the evening when we are starting questions, and we are actually bang on schedule, so this is good. Quite a few are popping up in the chat, and there are quite a few, some of them are going to be on themes, I notice. I will start coming to people, and I'll start sort of pretty much in order, because I know Tonia was the first person to put question in the chat, so it'll be Maggie that I go to first. But as I say, do write in the chat if you want to ask a question. I notice some people are writing their questions out. If you don't feel you want to actually speak, you can put your question out and I will read it out, but I will give you the option to speak because it's always nice to hear from people. So we will start off with Maggie.
I'm Tonia, the CEO of Absolute Support, and we provide support to adults with learning disabilities in supported living houses, so shared houses. So a majority of the people we support are clinically extremely vulnerable, so they've had their vaccination, but they share houses with people who have not been classed in the same category, but are completely anxious about the fact that they're not getting their vaccine and they don't know when they will have them, because they don't have underlying health conditions, but they are as vulnerable as their housemates, and their anxiety levels they have, you know, under prescription drugs for anxiety, and their anxiety levels are getting higher and higher. Is there anything we can do to help them have the vaccine earlier?
So it's a really good question, Maggie, and it's been a tension through the whole programme. They have just changed the cohorting, so all LD patients are now in cohort 4. So,
sorry to interrupt, but these are young adults with learning disabilities. They're not elderly people.
Yeah, so they have, but that is as of the last 48 hours. They've changed the cohorting. So one of the frustrations for us is you know, we're very sensitive to a series of populations. So the LD group would be a really good example, and you've also got some occupational groups as well. So teachers and police, and so. The difficulty is that if you go off-piste and locally decide to sort out your own criteria, you then just create inequalities, and you're going to just generate a lot of frustration in the communities. But the good news in my LDs is that they are now categorised as cohort 4. So it's meant a little bit of work for the sites to catch up with those, because up until now, they weren't a target area, but by the 15th, we need to make sure they are included now. So that's the good news on LD.
So sorry, can I just clarify? By the 15th, they should be.
So because the performance requirement is for the first top 4 cohorts by the 15th of February, LD is now included in cohort 4. And therefore, all LD patients should have been vaccinated by the 15th of February. And the supplies of vaccine that are going out at the moment, we're asking the practices to pay particular attention to make sure they select that group as a priority, because you want to be vaccinating the highest priority groups before you start moving down to lower priorities.
Brilliant. So we still wait to be contacted rather than contact the GP? Yeah. Brilliant. Thank you very much. Thank you.
But I suppose that's a good point about when to contact. So the small numbers, Maggie. So for the LD people, I would actually say just contact now. It might irritate the practice a little bit, but it's probably better to make sure that they are included, given that we've only got a few days to get that done.
Okay, brilliant. Thank you very much, Patrick. That's really helpful.
Nicola Wilson, I think you were next with a question. You wrote it in chat, but would you like to ask it, Nicola?
Yes. Yes, thanks. I'm just inquiring about carers getting the vaccine, and what is the route? I'm Nicola Wilson from Crossroads Care, Richmond and Kingston.
Thanks, Nicola. So carers fall into 2 categories really from this perspective. You've got the paid carers, who I regard as being frontline healthcare staff. So they are in cohort 2 and hopefully should have been done by the 15th of February. The other group is the unpaid carers, and they are in cohort 6, so they will be prioritised above other people who might be younger. Sorry, I've put that really badly. So if you're a 50-year-old carer, you will be vaccinated in cohort 6, which is the typical group of 60 plus. If you happen to be a carer who's older than that, you will be in cohort 5 or above, and they will be being done now. But cohort 6 will be started soon after the 15th of February. So how do we capture all those carers in the community? The practices have got registers of some of them, but they're probably not comprehensive. So we've been putting messages out through our local authority contacts to try and get the word out to carers to check that they are registered within their practices, coded on the practice system as carers. And we're asking them to contact the practices through the practice websites, but not by phone and not by going into the practice, because the level of work in the practices is huge at the moment. So unless you don't have access to those avenues, we would ask that you go through the practice websites. The local authority have a register of 2,000 carers, and we were hoping that we would just be able to do a straightforward data drop, but the GDPR regulations around that have made that harder than we were hoping, because that would have been an easy way of checking how well the practice lists correlate with the local authority lists. And the local authority also let us know that there are they estimate 16,000 carers who aren't on their registers as well. So the ask really is that the carers announce themselves to their practices so that they're on the register, so that when the practices search for cohort 6 patients, which will be happening probably towards the end of this month, I would guess, and that they are actually on those registers.
Thank you, Dr. Gibson.
You're welcome.
Thank you very much. We've got a couple of other questions in the chat that relate to unpaid carers and carers, actually, with a couple of ones. Jenny Shalom, your question sort of follows on a bit. Did you want to ask it around, I don't know whether Dr. Gibson will know the answer, but Jenny, are you there?
Yes, I'm here, thank you. Yes, I think my questions have probably pretty much been answered, but I did just wonder whether Dr. Gibson had any idea how many carers might already have been vaccinated, given the age differences. And because I understand that the population of Richmond, about 8.5% of us are unpaid carers.
Yeah. So the unpaid carers, because they're in that cohort 6, in theory, there won't have been an active search to pick them out. But what has happened is that, particularly when you're trying to balance work, so there's a constant balance here between trying to stick to the cohorts and trying to make absolutely sure that not a single vaccine goes to waste, and we've pushed really hard on that. So there have been occasions where some carers, to use up the end of a batch of stock, will have actually had access to vaccination, or where a site has taken the view that they're at the end of the day, they've got somebody who's in a cohort who's being vaccinated, and their carers come with them. They might, right at the end of the day, have been doing that. But what we don't want is for carers to pitch up on to vaccination sites on a day, hoping they're going to get a vaccine because there might be one left over, because it doesn't work that way. Because all of the clinics are set up so that there's a set of names dedicated to each vaccine at the start of the day. And the only way ones become available at the end of the day is if somebody hasn't turned up or something's happened, there's been some reason why they haven't been able to take up the vaccine. In which case the practices have been told to have a reserve list that they call at short notice to use those up. So there will be a few, but they're probably few and far between. But very soon, because Richmond has got to where it has been with cohorts 1 to 4, we're anticipating that we'll be able to start really working down into that carers group. When we get to cohort 6 is a big group. So it's got people with conditions that make them vulnerable. So there's a lot of people in that group, and there's a lot of people in the carers group. So we are asking the vaccination sites to prioritise particular groups. So we'll be asking them to try to get to the carers at the top of that cohort, So as soon as we get to cohort 6, we're asking the primary care networks to pick out those patients, because we would share the same concern that, you know, what happens to the individuals being cared for if their carer goes off sick. So there's prioritization within cohort, and that's really important in cohort 6 to get to the carers quickly.
I'm really pleased to hear that, actually, because I care for my mum. She has a live-in carer and carers coming in, and they're all vaccinated. And yet me, as her primary carer, if I go down with it, so I keep away from everybody at the moment. I had another question, whether you've been able to get to the carers employed by the local care agency to educate them about the vaccine as well.
Yeah, we have to. You learn a lot going through a program like this, don't you? And one of the things that we've picked up is you can't even necessarily just go with the carers who are registered with organisations, whether that be the local authority directly. So one of the things that we had to do, for example, was identify where the agencies for care staff existed, because we didn't necessarily have lists of them to vaccinate. So early on, it was really great with the care homes. So we were quickly able to access lists of people who worked regularly and were employed by the care homes. But of course, the care homes also use agency staff. So we spotted in the early figures that group were not being covered. So that principle of trying to get to the care agencies who are supporting the established teams, we are trying to get to them, and we've been very successful with them as time's gone on.
And have you been able to educate those people within the care agencies?
Yeah, so
you know, they're believing all the superstition, because I've spoken to some of Mum's carers and I cannot believe what they have said to me. There's just complete lack of basic knowledge, understanding, education is quite frightening.
Yeah, there are some slightly strange beliefs out there for sure. And yes, we have. So we have a care home lead GP, for example, who links in with each of the GPs who are attached to care homes, and they have all made themselves available to do staff webinars, staff Zoom meetings, any opportunities at all to try and get the information across. Clearly, it's a tricky line to follow. You don't want to be dismissing people's health beliefs, but what you do want to do is to be able to provide the information for them to help them to make the right decision and give them the opportunity to ask the questions. And that's what we've tried to do, and we will continue to try and do.
Thank you very much. Now I'm now going to go to Ian Haddow, who is a carer, and I think he wants to either ask a question or make a comment. So Ian, you'll be unmuted. There you are. Do you want to ask your question?
Thank you very much. I was surprised when on Thursday afternoon I got a text message saying you've been chosen to have a vaccine on Monday at Essex House. What time slot would you like? And I know that this was probably a little bit early, and I realise now why it was a little bit early. And that is because I am a carer for my 96-year-old mother, and I'm connected with the doctor knows this, and I'm connected with Richmond Carers and Crossroads, and Nikki I know quite well. And it was well worth waiting 10 minutes in the snow, queuing up to go into Essex House to get your jab. Once you're in, you're out. I don't understand why people don't want the jab. But there is a question that I would like to pose to Patrick. There seems to be a group in society that everybody seems to have forgotten, and it's so easy to brush them under the carpet, as it were. For the past 35 to 40 years, I've been doing voluntary work for homeless charities, which is rather truncated at the moment. There's absolutely no information at all about how you get round to deal with the homeless people and give them the vaccination that they will obviously need.
That's great, and so I'm really glad you raised that, because we had flagged that as being a significant area of concern. So, and we actually have a group who are concentrating specifically on that work. I think nationally that's gone up the agenda as well. So there were in the early JCVI cohorts, and they didn't subdivide, they didn't make any particular allowance for for homeless people. And then what happened was that they announced that the people who were looking after homeless people were regarded as frontline staff. So they suddenly became cohort 2, having not had a mention before that at all. And then there's a realization that we needed to do something about homeless. So actually, again, in the last 48 hours, they've been added to cohort 4. So they've gone from nowhere to cohort 4 suddenly. But we were working on this in advance because we knew that we were going to have a particular method for getting to that group, because obviously they're more ambulant, they're more mobile, they're not necessarily in the same place. Where are you going to go to vaccinate them? The way the vaccines are, even with AstraZeneca, you get a group of, you get a lot of vaccine, so you get a vial of 10 or 5, and you need to have a group of people together at the same place, in the same place at the same time, to use that effectively. So the good news is that we've got a dedicated team with a GP lead, with somebody from somebody from SPEAR. We've got a local authority representative. I can't remember who else is sitting on the group. So there's a task and finish group with Dave Worth as well from local authority, working out exactly how to get to that homeless group. I know that one of my practices today was out at the Vineyard Project doing some vaccinations there. So I'm really glad you raised that, Ian. Thank you very much. And that's why it's been a bit haphazard, because it hadn't been identified nationally that there needed to be a particular focus on that group.
It never is, because homelessness is never. It never is. People, as I say, try to brush it under the carpet. I do know that the charity that I'm working for at the moment, or well, as I say, rather truncated, is Glassdoor. They run out of Chelsea Methodist Church. And I do know that they keep a register of everybody who's connected to them, all the homeless people who are connected to them. And I'm sure that they all of the other charities run exactly in the same way. So that is how you can actually get a register of people, so that you know that they have been vaccinated.
Thanks, Ian. We have the numbers, so we know who we need to do. It's just a question of getting on with doing it.
Thanks very much, Ian. Right, Carol Marlowe, you asked a couple of questions, and I think one of them might have been answered, but you were just wanting some clarification about waiting for the 15 minutes after the jab. Do you want to ask your question, Carol?
Yes, please. Sorry, it's a general question, not about groups particularly, but I and people I know really want to have the jab. We're just a bit worried about the danger of getting COVID when you get the jab. So the point about, well, when the previous gentleman said queuing, I feel full of dread. And then the 15 minutes afterwards, where you have to sit inside with people. I've been shielding. I'll be in group 6. And I haven't been in anywhere else apart from to get my flu jab since March. So the thought of that really worries me. Can you reassure me in some way?
Yeah, I hope I can, Carol. So that was probably one of the biggest headaches that the vaccination sites had at the start, of how to do this safely. So avoiding queues has been important, has been really, really key. So all of the sites have tried to make sure that you're not going to end up queuing for very long. And there were some early pictures, I think, from southeast London of 2-3 hour queues. So there are marshals out controlling the queues, so making sure that people are socially distanced in the queues to start with, and hopefully they're kept to a minimum. And hopefully that was Ian's experience, that although there may have been a little queue, it will not have been a big queue. So we've, to my knowledge, certainly at that particular site, we haven't had big queues at any stage. And the next point then is getting people through that building quickly. So that has been absolutely key to how the vaccination site's been working, and to the extent where we have looked critically at some of the steps in the process. So vaccination cards is a really interesting one. So some sites are using them, some aren't. The vaccination card, from our point of view, we feel at the Shinner Barnes site doesn't offer significant value in this. You can't put a next vaccination date on it because we don't know when the vaccine is going to be delivered. We know what vaccine has been given to which patient. We've got that on the system. So what is the value to it? It can't be used by the patient as a legal statement of being vaccinated. So we dispense with that, because it meant the patient would have to stay in the room for that little bit extra time. The next bit then is waiting afterwards. So waiting afterwards outside in winter is challenging. So we've had to be really thoughtful about trying to do that. So many sites will have put in place marquees. They've put heaters in the marquees often. They've put gazebos up. We've been fortunate as AstraZeneca's come along, that you don't have to have a 15-minute wait for AstraZeneca. So it's a Pfizer product, you have to wait for 15 minutes. But the reassuring thing to you, hopefully, is that that has been managed in as well a way as it possibly can do. There's some people who clearly need to stay indoors, particularly in those early groups because of frailty. So we organised the waiting rooms so that there was social distancing in that. And we tried to plan the clinics as well, so that there would be chunks of people who were more likely to be and more able-bodied to be able to wait outside as well. So a lot of planning has gone into that. So definitely, do not keep that as a reason to delay it. The other thing we were conscious of is, was it possible with vaccination sites that actually we were going to see spikes in COVID, because you're going to have people there? So one of the early things I did with Shannon's team is sent messages to them saying, can you keep an eye on little outbreaks in communities around where the vaccination sites are? Unfortunately, we haven't seen it in any of them, so that's really good news.
Well, that's good news. I'm very pleased to hear you can actually wait outside if you want to. Thank you.
Thank you very much. Right, Juliet Amos-Lewis, I'm coming to you, and I'm hoping that actually, although I know CCG is doing some work on what you're asking a question about, I'm hoping actually there might be something that Public Health can respond on, just to bring Shannon into this, and also to give Dr. Gibson just a little bit of a break from all the questions. It's a bit like an Ask the Doctor session now, unfortunately, as we haven't got Tonia here as well. But Juliet, would you like to ask your question, and we'll see if there's a Public Health angle on this one.
Yes, thank you, Catherine. I'm Juliet Ames-Lewis. I'm the Chief Executive of the Richmond Charities. We house 150 elderly people in our 10 almshouse estates across the borough. All our residents are over 65, so the vast majority have had their first dose now, which is fantastic. My question is about the Black and minority ethnic community. We have a number in our community. I'm glad to say that they have all taken up the vaccine, but it has caused some fracturing in some of their families, because there are people in the Black and minority ethnic community who do not believe the vaccine is safe and have been trying to convince people not to have it. So I just wondered what is being done in Richmond to try to improve the uptake of the vaccine amongst this community.
Thank you for that question. This is clearly something which is not just a local issue, but a national one as well. And I think from earlier on, when we first started to get the initial data, the CCG were already working across southwest London with the local authorities to develop communication and engagement plans around the vaccines. And part of that, a big part of that, was to try and see how we can address any reluctance or mistrust that people might have around the vaccine, in particular ethnic groups as well as others. So, for example, I know that the CCG have already started to hold some listening events with residents who are from Black, Asian, or other minority ethnic groups. And also we identified that there's potentially some reluctance as well in some of the more deprived areas, and the CCG has been running jointly with the council some question and answer sessions with panels of doctors, and including one-on-one conversations with people to try and provide them with the right information. Now, in the local authority, we've also developed an external communication and engagement plan around the vaccine, and the point of that plan is actually multi-pronged. It's about just trying to manage expectations around the vaccine and when people will get it, but also trying to tackle some of the misinformation that's been coming through around the vaccines, and trying to identify particular communities that we can work with to build trust. There's a lot of work going on around ensuring that information is more accessible. It's all very well to think that people are just hesitant, but actually some of it is around accessibility of information. And so we've now got a whole raft of communications that are printed in different languages, for example, talking about the vaccine for people who do not speak English as a first language or might have difficulty accessing some of the materials. And I think forthcoming after this week will be a series of videos as well, with particular messages that are targeted at Black, Asian and other minority ethnic communities, again, just promoting the vaccine. And so, for example, yesterday I did something where I was just relaying some of the information around the fact that over 10% of the participants in the Pfizer and AstraZeneca vaccine trials were actually from Black African or Black ethnic minorities, and actually we haven't seen any difference. There's no evidence to suggest any difference in terms of how the vaccine has affected those groups compared to other ethnic groups. So there is a whole huge piece of work going on. I think the real difficulty is getting down to the nuances, because, as you will know, it's probably unhelpful to lump ethnic groups in very big clusters, because there are a lot of people actually who work in healthcare from a Black ethnic minority group, for example, who've already received their vaccines. And so we really need to try and find where those pockets are of very specific communities. And I think that's where the work is.
Can I maybe add a little bit into that as well? So thanks, Shannon, that covered it really well. So we're also recruiting sort of representative community leaders to talk publicly. Social media has clearly emerged as one of the areas where rumours spread. So there's a social media presence from the CCG as well, just countering some of the arguments that sort of circulate there. We've asked the vaccination sites to do one-to-one work with particular members of their patient list, the registered list, and we're also sending out clinicians to public environments. So that there's a meeting for one of the mosque communities that 3 of us are talking at next week as well. So we're trying to take every opportunity to try to get to those key groups, to be able to give them the information to help them to make the right decision, not necessarily to bully them into having the vaccine, but to make sure that they're making the best decision they can with the right information.
Thank you very much. That's really helpful. Could I ask an additional question, please, of Dr. Gibson quickly? Dr. Gibson, my frontline staff, all my scheme managers who are working with our elderly and vulnerable residents, they are, in my mind, frontline staff, but not technically designated as frontline staff. Is there any way I can get them bumped up the list?
It comes down to face-to-face contact. So if the nature of the work is face-to-face, we're going from person to person, you're going to end up in being in a higher risk group. So if it's really about it depends on the nature of how they work, is what I'm saying. So that issue about the individual carer looking after an individual patient, that's going to be cohort 6, as opposed to somebody who's going round from house to house to house, which is cohort 2 rather. So it depends on the specific nature of that. So if you can, my email address through that. So if you email the details of what they're doing, then I'm more than happy to look at that for you. Don't take it.
Thank you very much.
Right, a related question. The questions are coming in, so we'll have to sort of work quickly to get through them all. But Bernie Simcox, you're asking a sort of similar question to this, but do you want to actually ask your question rather than me read it out?
Yeah, hi everybody. So the Wild Mind Project is an organisation that looks after young people who are experiencing mental ill health. And so we're seeing groups of up to 10, but it's outside. We haven't been offered any vaccinations, or I know other therapy groups have. So I was just wondering if staff were entitled, and if so, who should I be contacting? Should I be contacting the GP? Because how would they know that we were a voluntary organisation, or should we be contacting the council? Thank you.
Yeah, probably not the council. It probably needs to be the primary care sites. Again, could I ask you to contact me directly about that one? It's complicated, but it is possible that we might well be able to do that, because it's all about risk. It's about what does the individual person's risk to the community represent, and if somebody's doing face-to-face with 10 people, there's clearly a significantly greater risk than somebody who's doing face-to-face contact or doing online support. So it isn't necessarily the nature of the employment that's relevant, it's how they are delivering their work. But in that scenario, I would have thought that we should be trying to prioritize that, but I've got to find a way of doing that. So if you can get to me, that'd be really helpful.
Okay, thank you.
Dr. Gibson, I know the council have actually made an offer to the voluntary sector, particularly those working in a sort of health and care setting, to be added to the list of sort of priority people. So I can also give the relevant email address to Bernie as well. So I will email you, Bernie, with that, because I think it's led by Richard Wiles. Really, they're very keen to ensure that staff and volunteers that are on the front line are prioritised as much as can be. And I think some people on the call will have been using that service. I don't know whether people have been vaccinated yet, but it's they're definitely getting on the list. Right, moving on, and apologies now, Christina, because I might pronounce your surname wrong, but Christina Latoweski, please correct me. Would you like to ask your question? When you're right.
Yeah, close, Lastovecki, close. I'm Christina, I'm Head of Children, Youth and Families for YMCA. So my question is, we have youth workers delivering outreach work in the community and also delivering one-to-one support to young people with mental health. We also run early years provision, and other areas of London have prioritised us and given us vaccines as part of both our youth work and our early years, but not within this borough. So I was just wondering if they do fit into the lower cohort, or because obviously with other early years providers doing a lot of intimate care with children with SEND and additional needs. Thank you.
So I would say that the pragmatic approach to this is to start to define those people as carers, really. I think that's probably the pragmatic approach to this, to be honest. Because they are carers, not necessarily primary carers, but they sort of, it's that profile of risk, isn't it, that's key here. And if they are in contact with a number of people, that's probably the way to go. So I would, again, Christina, could you drop me a note afterwards and just to clarify the best way of doing that? But on a first principles basis, I would be thinking in terms of categorising them as carers, and that's cohort 6, and that will be the lot that we're doing very soon.
Okay, perfect. Thank you.
Thank you very much. Jean-Louis Evans, would you like to ask your question?
Sorry, Catherine, what was the name?
Sorry, Jean-Louis Evans from Fish Neighbourhood.
Still muted, John, at the moment. Jean-Louis.
I've just unmuted him.
Thank you. Yes, I'm a trustee of Fish Neighbourhood Care. So I have a question about lateral flow testing. And I'm not sure whether Shannon's popped out, because I can't see him now. But the question really relates to the fact that a number of our volunteers are over 70. They've been vaccinated a few weeks ago. So is the lateral flow testing network that you've set up in the borough aimed as much at people who have been vaccinated as much as those who have not? Because from what I can gather, if you're vaccinated, it doesn't necessarily mean you're not going to catch COVID, but if you do, your symptoms will be less acute than if you are not vaccinated. That's really what I'm interested in.
Yes, thank you very much, Jean-Louis. And actually, you've highlighted one of my key messages to people, which is whether you've only just received your first vaccine or you've received both of them, you still need to follow all the rules, and you still need to test if it's asymptomatic testing, because at the moment we don't yet know to what extent the vaccines will have an impact in terms of stopping people from catching and passing on the virus. So if people do have some caring responsibilities, I would still strongly encourage them not only to test, but to continue to follow all the other social distancing measures and the public health guidance that has been given to date.
Okay, thank you, Shannon. That's very helpful.
Thank you very much. Right, I'm going to go to Val Farmer now, because Val's got a couple of questions which I don't think have been covered really. So I just want to make sure you get a chance to ask those, Val.
Thanks very much. So, Dr. Gibson, you mentioned that the cohort 6 is quite broad, and I wondered if people with a mental health diagnosis would fit in that particular cohort, regardless of their age.
Yeah, so SMI is categorised within that now. Yeah,
that's really helpful. Thank you very much. And secondly, you mentioned at an earlier meeting this week that unpaid carers should register, as you say, via the website with their GP, and helpfully if they could say who their cared for is. I know that we have a number of carers who's cared for are either not living within Richmond, or they may not want to declare that the person has mental health issues, and I wonder, is it okay to register as a carer even though you're not maybe willing to declare who you're caring for?
Yes, you probably know why I'm pausing about.
Yes.
Yeah, it's so important that we try to get the vaccine to the right people, and you know, the potential for exploitation of this is there. We know that.
I appreciate that. Now, I just wonder if there's something we can do to support it somehow, even if we're just saying they're registered with Richmond Borough Mind or the care centre.
Yeah. I mean, certainly, if you have people in that situation, you know, if you know you've had conversations with them, but ask them just when they've registered, just to say that they've spoken to you. So it just gives that a little bit of corroboration. Okay. I mean, I appreciate saying the name of the person looking after it. It doesn't give total corroboration either, but at least it gives you some opportunity to sort of sense check it. You're just trying to do something pragmatically to try and protect the vaccine for the people who most need it. Really.
Thank you.
Is that both? That's both your questions answered, Val. That's brilliant. Okay, right. Now we've had a question from, I think it was Alison Morgan. I've now lost it, but I know she was asking a question about councillors being vaccinated, which I think might be a similar answer to the one that we gave Bernie about. If I send you the email address, Alison, to ensure you have the contacts to see how you might be able to see if you can get your councillors vaccinated. Hopefully that'll sort that one out. Anthony Elman, you were asking a question that wasn't really voluntary sector related. It was regarding your wife who's received the first vaccine dose, and you're concerned about whether she will be told sort of when she needs a second dose. And I understand really from what Dr. Gibson has said, she will be contacted by the surgery and she doesn't need to worry about the moment. And forgive me, Anthony, for asking the question for you, I'm just conscious of time. But Dr. Gibson, Anthony says, at what stage should she start asking if she isn't contacted? Are you fairly confident she will be contacted within the 12 weeks since the 30th of December?
Yeah, so we're told that we will have supplies, and we keep asking for reassurance on that, and we keep getting the same message, it will be okay. They've put aside vaccine that they're going to send to us for that. So we're anticipating it'll be in week 11, 12. So if you get to the start of week 12 and nobody's contacted you, I suppose that's it. So work out on your diary 12 weeks from when the first one was, and if you haven't had a contact at the start of the 12th week, that's probably the right time. But so we're expecting it to be the 11th, 12th week.
Right, so fairly close to the wire, but that sounds like a good approach. So thank you for that.
One thing I would say, I don't know if people heard Sarah Gilbert on Andrew Marr on Sunday. She's leading the work at Oxford, and she made the point that actually, if you go over 12 weeks a little bit, it really isn't crucial. It's not like your immunity drops off the end of a cliff after that. So if there are problems, really people shouldn't be anxious about that. Logistically, you want to get it done in line with what we've told people is going to happen, but it isn't a catastrophe if it's done on week 12 plus 1 day.
Thank you for that, Dr. Gibson. And we are getting to closing questions. So if there is anything else you want to ask, do say now, and then there'll be a general question for the panel and one for the audience as well. Mark from the Good Gym, you were asking about how some of your people who are interested in volunteering can sign up. And my colleague Julie Gavin has helpfully put the link to the Richmond CVS website where we run the volunteering service. People can sign up there if they want to help. We have actually helped, I think it's 3 of the local vaccination centres to find volunteer marshals. I know some of them are using their patient participation groups to source volunteers and other local contacts, but we've also been able to do that. So we do advertise things. Well, Mark, you look like you're about to go out for a run now, actually, with your hat and jacket on, but it's a good way of people keeping in touch. We're sending out newsletters when we hear of opportunities, and some of them have been quite last minute. So we're pleased that we've been able to support that, and it has been fantastic, the reaction from local residents to help. Is there anything else you wanted to add on that, Mark?
No, appreciate, I mean, this is great to be involved with, and thanks to all these insights and inputs. But yeah, definitely, that was the main thing. I've got a number of volunteers at the minute who are just scratching around for things to do, and they can't wait to get involved. So it's just nice to point them in the right direction.
Thank you for that, Mark. Yes, and I would say actually we're finding that supply is greater than demand at the moment, so we're asking people as well to be patient. This is going to be quite a long road as such, so I'm sure people will get a chance to help in the coming weeks and months. So thank you for that, Mark. Also, a nice comment from Anne Speak, who's from Richmond Good Neighbours, talking about the support from the council around accelerating the offer for vaccines to voluntary sector and getting their volunteers on the list. So that's really helpful. So thank you for that, Anne. Now I'm going to get to the general questions because I'm conscious we must finish on time. There was sort of a question I have for the panel, which is around them sort of whether they have any final messages about how local groups and organisations can support the rollout of the vaccine. So that's just a chance for Dr. Gibson and Shannon to think about that for a moment. So is there anything else they want to say about how local groups, the voluntary sector, can help support the rollout of the vaccine? But also this is a two-way process. So I'm also asking the audience to think about whether there's anything else in terms of information and support that you feel you need from the council and the CCG to help you support your clients to have the vaccine, or anything else that would help you with this process around the vaccine. I think we've had a lot of questions answered this evening, which has been really helpful, but it was just if there was anything else that you're thinking you could see a problem or a challenge or something else you'd like support with. So I'll ask the 2 panel members first, and if there's anything else that anyone else wants to add in the last 5 minutes, we can do that. So Shannon, do you want to go first?
Yes, thank you very much. Obviously, it's been mentioned that already in Richmond, we've seen a good level of uptake of the vaccine for the cohorts that have been called forward. I think the point around trying to target any disinformation and trying to find those communities where we think people are less likely to take up the vaccine is the real challenge. And so I will be asking people to come forward if they think that they can help to identify, or they know of particular communities where we need to do more work to tackle that. And I think that's how you could really help us. I think the vast majority of the good people of Richmond will turn up for their vaccines when they're called, but it's really around the inequalities and trying to ensure that everyone who needs vaccine accesses it and has the information that they need to take it up.
Thank you, Shannon. Dr. Gibson?
Yeah, I think it's also just helping to manage expectations would be really helpful. So the message about patience until you're contacted, until you reach a point at which there's a national message that you do need to make sure you've been picked up. So for the over 70s this week, the message is now is the time to contact. So patience with that. And also just encourage people after vaccination to still continue to follow national recommendations. So hands, face, space, you know, we're still going to need to have that in place until enough of the population are protected. So it doesn't mean you can go out dancing at the nightclub the day after your vaccine. So just reinforce that message. And well, we don't necessarily want people to challenge other beliefs. If you're hearing of beliefs that you know are not what you've heard here or in hopefully reputable environments, and just directing them back to me or you know, my other clinical leads, because we can help to have those conversations. And if people want to have that opportunity to get good quality information, that's what we're here for. Yeah, there isn't going to be anything else during my career that is going to have as much significance as this, and we've just got to make ourselves available as much as we possibly can to get it right.
Thank you. Right, we've had two other questions come in that I want to cover, a minute on each perhaps, before we close. And forgive me again, I'm going to read them out for the sake of time. But Anne Speak from Richmond Good Neighbours has asked whether the vaccine is being extended to those with dementia, and whether there is a need for family member for consent if the person's not able to give consent themselves.
Yeah, excellent question. Of course, it's being offered to people with dementia because it may well be that that they want to do that. But it is an interesting judgment, isn't it? Those of us who've been there with elderly parents know what this discussion's like, really. So the discussion is not solely with the person who's got dementia. You're trying to find out who is the person who's able to act in their best interests if the individual is not felt to have capacity to make a reasoned judgment. And families who've put in place power of attorney are clearly in a really good position on this. It's having that trusted advocate. So definitely it's being offered. They're not being excluded from this in any way at all, but we're being led by the individual patient with dementia if they've got capacity, or by their relatives.
Thank you very much, Dr. Gibson. And then Peter Knipe, who's a local resident, has asked just a quick question on whether there's been any noticeable reticence in people refusing the Oxford vaccine when they're offered that rather than the Pfizer one. Are you noticing any competition going on?
It depends on your attitude towards how wonderful nationhood is, or what the latest news broadcast, because there are so many studies that come out that demonstrate something that's marginally different. All I would say about these vaccines is that they are incredibly effective and incredibly safe. They are significantly more effective than the flu vaccine that we use each year, and the flu vaccine is a really good product and has helped us in many, many winters. And so these are excellent products. You can't compare one with another. You're only going to be able to make any sort of judgment at all when you've got all of the data. So a large part of the data is how long do they offer protection for? And of course, we're not going to have the answer to that until we get through a year or so. So if anybody's telling you that one vaccine is better than another, there's not really any evidence that supports that view. It really reflects people's individual prejudices, and that's fine. But just because you decline one doesn't mean that you can't be entitled to another one. So if a site only has one particular product, you're perfectly at liberty to decline it on that occasion, and wait until they contact you again. And check if the vaccine is available, and then you can decline again. If you get through those 3 declines, you won't be contacted again, but you can check in to see whether, at a later date, to see whether the product you want is available. But I would just say to people, why in the current situation with the evidence we've got, one isn't better than another. They're both excellent products, and Moderna will be probably arriving fairly soon as well, and the data around that is similar.
Thank you very much, Dr. Gibson. Right, I'm going to bring this evening to a close. I don't know whether either of the councillor wants to add anything at the end, but I would just like to say a big thank you, particularly to Dr. Patrick Gibson and to Shannon Katiyo for doing a sterling job this evening, presenting and answering all the questions. I'd also like to thank the council for sort of hosting the event tonight and doing all the background stuff. I know it's quite a job, so thank you for doing that. And a particular big thank you to all of you as the audience for taking part, asking a lot of excellent questions. As Ellie said, I think in the chat earlier, you will get an information pack which will include the slides and some of the information that has come out this evening. As I mentioned, this is a two-way process, so it's been really good to have the session tonight, but do bear in mind you can continue to ask questions, either contact the council direct, or you can email Richmond CVS if you have things that you want to raise, because I know we're all keen to sort of work through this together and ensure it is very much a partnership approach. So thank you very much for that. Councillor Allen or Councillor Wilson, was there anything else you wanted to say before we close?
Just to say, this has been a really useful session, and I welcome so much, great participation of everyone. Sorry, I get a bit of double echo. I would just say, Councillor Wilson and I are also very happy to hear of any groups that would welcome extra communication and so on. So please do feed your any pointers to us, and we'll make sure they're passed on to the comms team and to our NHS colleagues.
Thank you very much, Councillor Allen. Okay, well, it is now 6:30, so we'll close the meeting. Lovely to see you all, and I hope you enjoy the rest of your evening. Thanks very much. Bye-bye.